Now I'd like to demonstrate some bleeding of a Jing point. So the Jing points, of course, are the most distal points on the acupuncture meridians. We make that imaginary line down the corner of the nails, the bottom of the nail, the side of the nail, and it brings us to the point that we call the Jing point, or that ending or beginning point on the meridian. I'm going to use an auto lancet, which has already been preloaded with a lancet. We set the auto lancet to its deepest point. I have on a pair of gloves because I'm going to be coming in contact with blood, and I want to make sure that we're both myself and the patient is protected. I'm going to take a cotton ball with a little bit of alcohol in it and clean that point. And then I'm going to take a dry cotton ball and I'm going to keep it handy. The technique that's going to be used, let me explain it before I actually do it, is I'm going to place the auto lancet device against the Jing point. I'm going to press this little button, which will release the lancet and let it lance the skin and put a little hole right there at the end of the meridian. And then I'm going to trap the blood a little bit like this. Let me just place this down. I'm going to trap the blood at the end of the finger by making a ring around the digit like that. And I'm going to squeeze, and then I squeeze a little bit, pressing the pad of the finger and the nail of the finger together. This is not absolutely necessary on every Jing point that you're treating, but when some people, it's much easier to get a few drops of blood out of a Jing point than others. Some digits, it's much easier than others. The little finger, the little toe, sometimes are difficult to get the blood to come out, and just in some patients, sometimes it's difficult to extract any blood. And so this trap and squeeze technique, while it's not necessary every time, it is necessary many times, so we will demonstrate it for you. Right? And the other thing that I want to mention is, before I get started, is that once the blood starts to flow from this point, we don't want to press on it. I don't want to stop that blood flow. If we're treating, let's say, for pain along the pathway of a meridian, we might want to extract 6, 8, 10 drops of blood. And if we're going to try to get 10 drops of blood out of there, if we press or if we wipe the blood every drop, then that pressure is going to stop the bleeding. So we want to just kind of soak up the blood a little bit so we can get our 6, 8, 10 drops of blood, whatever we're looking for. Okay? So I'm going to cock this auto lancet device. It's ready to go. I'm going to hold the patient's, I'm going to take a look at the center of that hole, and I want to center it over where I believe the Jing point is, or very close to it. Hold it firmly against the finger. Press the button, there's a little snap. And then I'm going to trap and squeeze. And you can see we easily get a drop of blood. And then I'm going to just soak that blood away, let the cotton ball take it up. There's one, and then trap and squeeze. And there's two. And this should be comfortable for the patient as well. Trap and squeeze. And there's three. And we just continue this process. Trap, squeeze, and soak. Trap, squeeze, and soak. Trap, squeeze, and touch. Just like that. And 8 or 10 points. 8 or 10 drops, from the point. And once we're complete, we can put a little pressure on that point. And oftentimes that will be just sufficient. The bleeding will stop. If the bleeding doesn't stop, as it has in this case, we could always just take a little piece of that cotton ball and put it over top of the point and ask the patient to just hold it on there for a second. They can just reach around with their thumb and hold that in place. But usually that'll do it. And that can be sufficient for treating pain, tension, or tightness along a meridian, or if we were bleeding lung 11, that could be for treating for a sore throat or something like that. Okay. Let's move on.